In this section of my online program, I'm going to talk to you about some different ways to organize all of the content that you need to study around disease management. In this section, I'm going to speak to something that I call study mapping. Study mapping is a way to use the nursing process to organize disease content. And it is actually kind of a first step in a process for studying, where you're really creating these wider maps where you can put the basic information onto the maps and then, as you're studying, go into more depth. Because one of the challenges that I find with NCLEX preparation is that students take a lot of time to actually just organize all the content that they need, and they end up with just all these stacks of note pages and not really something that they can refer back to help them study. So on this first page of the Study Maps module, I talk a little bit about how to decide which disease conditions to study map. What you're going to find on this first page is a list of all the diseases that I could think of. I went through a med-surg textbook and I organized disease processes in terms of systems. So the first thing I want you to do is to download that map, that list from the site. Take a highlighter and highlight all the diseases that you're just completely unfamiliar with. And then I want you to go back onto the map and I want you to highlight in a different colored highlighter the diseases that you know a fair bit about, but that you need to study more. And then lastly, take a highlighter and highlight the diseases you feel comfortable with. The first two sections, the diseases that you don't know and the diseases that you feel just a little bit comfortable with, that's what we're going to use for this study mapping exercise. The other thing I have on this page is an example of a map. So I'm just going to hold this up for my webcam here, make sure you can see it. This is one on acute glomerulonephritis that I did a while back. And I'm going to show you how these maps are organized. You're going to see in the center of the map here, I have the title of the disease condition and the symptoms. Symptoms are really important to study for the NCLEX because a lot of the select all that apply types of questions in disease management often focus on symptom recognition. Then underneath the symptoms here, I have just a general outline of the pathophysiology. And then I move to assessment, diagnosis, treatment, and I also always include nutrition in regards to the pathology as well. And then you can just see on this one here, I talk about hypersensitivity disorders. This is just part of the pathophysiology of acute glomerulonephritis. So many of my students don't actually take the time to make these maps using their computer. They just do them by hand. But the key is to get a large sheet of paper like I've shown you. And on this page as well, I just show you a basic framework of how you can use the nursing process. So physiology of the condition in the middle, assessment, what you would find when you assess a patient, diagnosis on top. So not nursing diagnoses. I want you to focus on what are the medical diagnostic tests used for that condition, and include diagnostic tests and of course any pertinent lab results. And then go into the treatment or the intervention section. And what I'd like you to put there is, any pharmacological treatment, just list the drug classes, any changes in diet, nutrition, and then what, expected nursing interventions would be. So what a study map does is it allows you to have that organized content on one page. And then often what I'll do on the back of these pages, so here's my, upside down, here's my front. On the back, I'll actually write case studies or notes. And I'll even append my drug cards to these maps. So for example, if I'm giving medications alongside the pathology, I'd list the classes on front and then attach it to the back. What these do is they give you a tremendous amount of control over the content that you're going through. And by the end, you should have about 40-50 maps that are done. And then that way, when you're studying a disease condition, you can just pull your map out. Now, when I say 40-50 maps, I'm sure a lot of you are like, oh my goodness, Marty, how am I going to do 40-50 maps? I recommend that you actually get in study groups and you take a look at your lists and the diseases that you're all having trouble with, and you agree together to map them and split the work up. So you create these maps, photocopy them for the members in your group, and then what you do again is you keep these maps as a starting point. And when you're in your study groups, you bring your maps with you. And when you're going through practice questions, for example, take a look at the themes that are coming out around that disease or the pathology within the practice questions and write them on the back of your map. And then you're going to start to see, these are the types of questions that are going to be about, coronary artery disease, for example, or about type 1 diabetes. And then that helps to narrow your studying as well. So I wish you luck as you build the maps. You'll find that I have a few maps already created just using basic Prezi to kind of help you get on your way in regards to what you need with the maps. When you're done with your study maps, please go to the next part of the section where I speak about content mapping. It's a bit more of an active strategy for figuring out what you need to know when you're studying disease management. Thank you and good luck.